we do have a lot of misconceptions about brain diseases. Oftentimes, people see brain disease as a problem that has to do with maybe, someone has been possessed by the genie, or someone who has been, bewitched by some other person. We really kind of confuse real cases of those conditions and real biological problems that affect the brain. So people are not aware, and this is why over the last probably 6-7 years, myself and a lot of other people have been organizing outreach activities to raise awareness around brain diseases.
When does someone become concerned that they may have Alzheimer's?
In terms of the science and other things, there are many different things. One of the major things is the gradual loss of memory. And obviously, there is irritability, confusion, poor or decreased judgment. When someone is aged and they start seeing the person having memory problems, they should not just say this is aging. They should try to observe that individual and, if necessary, go to a healthcare center so that the person would be seen by a proper health personnel.
There was a treatment that was approved recently here in the United States, but has led to a lot of controversy. Apparently, there is no treatment for Alzheimer's disease. So what is done right now for patients?
At the moment, there's no real treatment to stop the disease from progressing or to cure it. Most of the treatments do kind of help in alleviating some of the symptoms. It is important for researchers around the world to continue working to really figure out what is going on. But in Africa, we do have a major challenge. And our major challenge is that even these drugs that are produced from in America, or those that have been approved in America and everything, access to those drugs is a big issue. Oftentimes, people manage people with those conditions using traditional medicine, and sometimes by isolating them. We don't really even know much about how this condition starts or progresses in Africans. And even the risk factors can be a bit different between Africans and other people.
Where do you think going forward the priorities will be? I know you talked about the importance of research.
Awareness is definitely very important to help people to go and get checked if they have problems. Research into treatments and other things is also important, simply because the cost of therapy is important. We have to think about, in African context, would it be affordable? And therefore, research into these things within Africa, using our own resources, might help in unlocking some treatments that might be affordable. Africans are known to use traditional medicine, for treatment of diseases. And there are researchers working on that to see whether they are effective against brain diseases like Alzheimer's. And I think those kind of researches should be encouraged, simply because it may help in kind of unlocking some therapy which can be affordable to the people. So I like combined approach. And another thing that I should mention is that we should also kind of upgrade our health care system, specifically in terms of the diagnostic things related to these conditions. At the moment, there are fewer neurologists in Africa. I mean, some countries don't have even up to 20 or 30 neurologists. Even Nigeria, I think, based on estimates from a few years ago, there are probably about 80 to 100. So it is the neurologists that would even be able to make proper diagnosis of this condition. But even the neurologists are challenged by the lack of the facility. At the moment, most of them use kind of questionnaires and other things like that to make diagnosis. But in reality, to make diagnosis of such conditions, you need more than that. And it is expected that our life expectancy is going to increase. So if we don't really have that package of management research, we might end up in a big problem by that time.
Thank you so much for enlightening us on the issue of Alzheimer's disease.
Thank you for having me, Linord.